Welcome back. Well, it's World TB Day today. The day aims to raise awareness about the virus and aid efforts to end the global epidemic. Now, the World Health Organization has also declared this year's theme as, and I quote, "Yes, we can end TB," and it aims to inspire hope and further encourage high-level leadership to do more to accelerate efforts to curb it. Now, last year alone, South Africa reported over 300,000 cases of TB, and that's where the conversation starts. Of course, Russel Rensburg from the Rural Health Advocacy Project comes in under the umbrella of the South African TB Accountability Consortium. It holds government accountable to ensure that South Africa achieves its TB goals. Russell's joins me this morning. And Russell, thank you so much for your time and good morning to you. I suppose my first question to you is, do you think the current treatment and, preventative or prevention interventions with regards to TB infection in the country are actually effective? Do you find that they are helping in reducing the rates regarding TB?
Look, I think TB is a very sticky issue because it's not so easy to treat like a lot of diseases. And I think we have to start off from the starting point that since 2007 to date, we've had some successes in the TB program. We've reduced TB incidence as a country significantly, by almost 60%, and we reduced TB deaths amongst people living with HIV by as much as 90%. But here's the thing, and you know that the World Global TB Report gives us two things. First thing, it says that our biggest challenge is probably not so much getting people into care, but is really the diagnosis that is the linkage to care. So over 304,000 people acquire TB, but only 174 to 181,000 people actually got a diagnosis. So our biggest challenge at the moment is really improving our diagnosis of TB, and particularly asymptomatic TB. There's people who have TB, but they don't show symptoms.
Russell, also understand that you had conducted a rapid assessment of the accountability mechanisms at the national level, and two provinces, of course, that carry the highest burden of TB in the country, being KwaZulu-Natal and the Western Cape. Tell me what you found in that assessment in as far as accountability is concerned.
Okay. I think the main thing we found is that we need a much stronger national TB program to be able to coordinate the response across the different provinces. Unfortunately, at the moment, those mechanisms are weak because health is a concurrent responsibility between national and provincial departments of health. So we found that it was difficult to hold provinces to account because they all didn't report TB in the same way. You know, often these provincial annual reports focus more on trying to amplify success rather than looking at the challenges. The second thing is we found that the national TB program, while we're relatively good on developing national guidelines, we're not quite as good in distributing them and sending them down to the provinces. For instance, the TB plan, we didn't see any guidelines on provincial websites that people could reference. And those are very important accountability measures. But we do have the data. I think the important thing that we need to do if we want to double down and achieve these targets is really have a much more data-focused approach. And that includes making sure that people know how are we performing against our targets at a district, at a provincial, and at a national level, so that everybody involved in the TB response can sing off the same hymn sheet. And at the moment, we're not finding much of that.
Yeah. Russell, I'd like you to further elaborate on that point, please, but focusing more on the National Strategic Plan for HIV, TB and STIs. I understand it's due to actually be released by the South African National AIDS Council today. What key policy interventions do you think this plan needs to include?
I think that, for me, the single biggest thing that's not included in the plan is how do we coordinate the implementation of the programs, right? I think we've set some really good, ambitious targets, and there's some good strategies to implement those targets. But who's responsible ultimately for implementing? And I think that's kind of where the Achilles heel is of these plans, because they're very high level. They don't always cascade down to the people who have the responsibility for implementing them. And the accountability mechanisms that we have to hold, firstly, the National Department of Health responsible for implementing the plans are weak. And then secondly, provincial departments and things like HIV, TB are all located within like a whole alphabet soup of district health services. So it's very difficult to get routine data out of the system that allows us to have better accountability. And it's also not very clear to see what is the relationship between the various actors, including the South African National AIDS Council, which in a sense has responsibility for the plan. And then secondly, the National Department and Provincial Departments of Health, who in many ways are the main implementers of the plan. And I think going forward as the Accountability Consortium, we will literally really just look and see whether we can have more data-driven approaches, not just to guide implementation, but also to inform governance, because we have the data. I think it's just a matter of bringing everything together and all people involved in the response speaking of one hymn sheet. So greater coordination is the key to our success.
Yeah, and I suppose on my last point to you before I let you go, when we talk implementation, we know that funding for treatment programs is a point for contention. How do you think government can ensure access to these programs, both locally and at a national level?
Like I want to probably turn the bus again. We need to be more effective in the kind of options we use. It's very difficult running a health system like South Africa, where we have a limited funding and that funding is reducing. And sadly, most of our money is still spent on the higher levels of care. And that's not to say that those things are not important. It's super important that people have access to care. But what we need to strengthen is the efficacy of funding to primary healthcare services. So we have 7 years to achieve universal health coverage. Addressing TB and HIV are important components to achieving universal health coverage in line with the SDGs by 2030. So I think we need to start with 3 different approaches. The first is really to let the data guide us. We need our strategies to be informed by health system information, which moves bidirectionally between districts and the national and the province, and we can guide those decision making and allocate funding where we need it most. In the case of TB, we know there are 10 districts that have the highest burden of TB, and just eradicating it there or improving implementation there can result in better outcomes using the strategies as a guide. The second thing is to look at our financing and try and understand how we can channel money to those areas where there's the greatest need, right? And will have the biggest impact on a population level. And I think there we need many actors to be involved in the conversation. At the moment, provincial health departments make those decisions on their own. And the last thing is to adequate and appropriately trained HR to address some of these challenges. And I think that's the kind of focus that we need to bring into the implementations of the plans in order to achieve the results, not just for TB, but for all frontline diseases like maternal and child health care services, reproductive health services, particularly in the rural areas, which are often behind the track on national performance. So I think data-driven decision-making, improved governance, and improved accountability are the kind of things that will navigate us through these challenges of minimum funding.
Well, I appreciate you speaking to me about this, Russel, and bringing this point across this morning. Russel Rensburg, thank you so much for joining us. Rural Health Advocacy Project's Russel Rensburg, just reiterating the point that data is so important in understanding exactly the magnitude of the problem, but also how all stakeholders involved, including government, can better, implement policies around, of course, curbing TB, HIV, amongst other diseases in South Africa.